question, what's an incentive gift card?
It's just something we figured will encourage more patients to come in to get their regular needed screenings for the cancers. So it'll be probably a
Like the Visa gift cards that you hand out or something.
That was the only thing I didn't.
yeah.
Now, if you want to just bring the presentation back up. Yeah. Just, now, do we have, I think we're going to have some questions, right? You guys have.
I can give some comments about the presentation. I really like the idea of the education, patient education, seminars and cancer prevention. I think it's a good idea to give more education to patients so they can take care of themselves much better. That would reduce the costs in the future. I would actually like to see more numbers about the prevention and early diagnosis, how that prevention and early diagnosis lowers the cancer costs. I'm sure there are lots of numbers out there. I would like to see that kind of information, like more tangible information there, that would give me a better idea how it prevents in general. But in overall, I like the clinic. I would like to see one around.
Okay. I guess my comments would be that I think you developed a very good understanding of electronic medical records. That was very clearly stated. On some of the medical terminology, you needed a little help with the pronunciation of those words. And also, the only other thing I would like to have seen, again, in conjunction with your comment, is some numbers that show once you, on your pilot program, what do you think the cost reduction would be? Where would the savings be with early diagnosis and prevention? And let's see if there was anything else. I'd like to have seen a little bit more expansion on some of the terms. You did a lot of reading of what you had up there. It was very packed full of knowledge, but I would have liked to have seen a little bit more explanation of some of the treatment protocols that you were talking about. Some of them are, how would you explain it to a patient? How would you explain, I'll ask you a question, how would you explain brachytherapy or cryotherapy so that I could have a choice which one I want to do?
Basically, brachytherapy. I think it's less invasive. Like it's not as painful as like cryotherapy would be. Basically, what I had said before: small radioactive seeds are implanted into the prostate where they irradiate prostate tissue, rather than like thin needles are inserted. Because if I hear needles, I don't think I would want that procedure, honestly.
And do you know what the cost difference would be if I have to pay privately? I don't have insurance. Which one is going to be less costly, or which one is going to bring more income to my facility?
I think the needle ones. Yeah, the needle one probably would be cheaper than the more painful one, so that would probably bring in more money.
In the slide, in a nutshell, when you say our pilot program will cut the cost by close to more than half, was that based on anything you read or anything you saw?
We did, yeah, well.
Can we go to that slide?
We did a lot of research on how we could reduce certain cancers or the spreading of cancer by offering more screenings or getting patients to actually come in to do screenings. And based on those numbers, I guess we should have included them, but based on the numbers that they were showing on the computer or on the internet, it looked like it would really cut it by it's either exactly in the middle or a little bit more than that, but we didn't include the numbers in there.
Yeah, I mean, with how in detail you got about the number of positions and number of locations, I think that you would need to include the numbers because you need to show part of the accountable care organization, part of the pilot programs is the physicians will receive money back from the insurance company. So them just cutting the cost in half isn't a good thing because that's their income, that's their money, that's the physicians. That's how they make their salary. So if they're going to cut the cost down to the patient by half, their reimbursements are going to be less. Then you probably need to tell them how they're going to make up for that, how they're going to, because they're never going to do anything to cut into their own profits. And then the only other question I had was, a couple slides later, the prevention and follow-ups. This isn't immediately after 10 days of discharge.
It was supposed to say immediately there will be a follow-up scheduled.
Okay. Oh yeah, I wasn't sure.
You put immediately after 10 days.
Yeah, I didn't know if it meant you were gonna wait 10 days
No.
before you follow up. And the list of medications emailed to patients is good for some, but you also said that most cancer patients are over 65. And that may not be.
They did say they were gonna mail it too.
I said
They
I'm not
added
speaking,
that.
but it wasn't in there.
Right, yeah, she did say, so I thought when it said email, I thought, well, and if you're really sick, you might not want to read your email.
Maybe I would move this diagnostic imaging and lab testing information. It was about the whole clinic institute, right? That's like diagnostic imaging, lab testing on the fourth page. I'd probably move that a little higher to the clinic information side, because we had the clinic information on the second page, and then we had some cancer information, and then we had another clinic information right after cancer. Am I missing that?
So you didn't like the flow?
Right, it was like we had some cancer information, and right after the cancer symptoms, we learned something about clinic also in a separate slide. I would move it to the starting point, because we talked about clinic, we gave some information about clinic on the second page, so it would look much better for the consistency of this.
John, I thought of something that when you said that about, the physicians wouldn't want to cut the cost, and I think that would be a very good debate. I think they need to come back to you and stand up for their pilot project. I mean, the government on this hand is saying, we want you to cut these costs in half, healthcare is too expensive. And you are representing the side of the doctors or the business owners saying, well, I want my income, how are you going to come up with it? So